From the outside, it's easy to think that somebody's got it all figured out. Because my hair is curled and my cheeks are intentionally flushed, I must not have a care in the world. As if it were expected for my demons to be worn like a scarlet letter pinned to my chest. And they assume if you cannot see it, then it's not really there. As if pain does not exist unless you're bleeding or slung in a cast or staggering with a limp. But sometimes the most painful demons are the ones they can't even see. So we learn how to smile, how to grin and bear it, because nobody likes to talk about the tough stuff. Hell, I don't like to talk about the tough stuff. I have anxiety.
Every year in America, more than 3 million people are diagnosed with generalized anxiety disorder, and almost 20% of the American population has it. Anxiety is the most common mental illness, but is not to be overlooked. There are also other types of anxiety disorders, which include social anxiety disorder and agoraphobia. By definition, anxiety disorders are a group of mental disorders characterized by significant feelings of anxiety and fear. Anxiety is a worry about future events, and fear is a reaction to current events. Social anxiety disorder is another disorder that affects many people in the United States. People with social anxiety disorder have a marked fear of social or performance situations in which they expect to feel embarrassed, judged, rejected, or fearful of offending others. Another anxiety disorder that affects many is agoraphobia. Agoraphobia is a type of anxiety disorder in which you fear and avoid places or situations that might cause you to panic and make you feel trapped, helpless, or embarrassed. You fear an actual or anticipated situation, such as using public transportation, being in open or closed spaces, standing in line, or being in a crowd.
Some of the symptoms of anxiety disorder include rapid heartbeat, excessive trembling and sweating, nausea and dizziness, chest pain and headaches, and weakness in the limbs and muscle tension. These can be more or less sensitive to stimulation and stress than others, which can remain when they grow up. People that are more sensitive to this as a baby are more likely to have anxiety disorder because their nervous system is more easily aroused. The nervous system, the cardiovascular system, the respiratory system, digestive system, excretory system, and endocrine system are all responsible for the changes that cause anxiety symptoms. Several parts of the brain are key actors in the production of anxiety and fear. Using brain imaging technology and neurochemical techniques, scientists have discovered that the amygdala and the hippocampus play significant roles in most anxiety disorders.
There are many different treatment methods for anxiety disorder. The important thing is to find the one that works for you. We spoke with Dr. Cindy Poster on her experience in treating people with anxiety disorder.
One of the most popular is cognitive behavior therapy, CBT, in which I teach patients how to change their thoughts and their behaviors, which then bring about changes in the way that they feel. An active part of CBT is having the patient do homework. They learn skills in the therapy session, then they have to practice them when they leave the therapy session during the week. Another type is called dialectical behavior therapy, which is a shoot-off of CBT, which was developed by Marsha Linehan, and that basically is integrating contradictory beliefs. So giving skills to change unwanted thoughts, behaviors, and feelings, and then accepting what is. Another therapy is obviously medications, everything from SSRIs to SNRIs to beta blockers and the like. Another is supplements. Another is biofeedback, which you put electrical sensors on somebody and it feeds back what's happening physiologically inside of them, and I teach them techniques to be able to change that, things such as heart rate and such. People also do acupuncture, people do meditation. There's a lot of things that you can do to treat anxiety.
Now that you know how this illness affects people, we're going to look into a case study of a man named Joe who has a social anxiety disorder. In his life, he is fearful of all social interactions. If there's an appointment to be made, his wife makes it. If they are ordering a dinner, his wife has to make the phone call. This disorder has taken over his life and has even made it difficult for him to keep a job. The business that he worked at was a small-time record store. He knew the owner very well, and the owner was one of
the only few people he felt comfortable working with. While working, when he made phone calls to tell people that orders were in, he wouldn't be able to finish his sentences, choking, stumbling his words, and finally mumbling the rest of the sentence so fast that the person wouldn't be able to hear it. This illness has been a part of him his whole life, and it has taken him over.
I once had a little girl who had a bug phobia and she was leaving for camp in 2 months. So I treated her with exposure. And basically, first we talked about bugs the whole session and her fear of them. Then we looked at photos of bugs in books and the such. Then we looked at videos of bugs. Then we'd go to the park every session. And at first we'd look at the bugs, then we'd see the bugs crawling up my arm. And by the end of the treatment, she had bugs crawling up her arm and she went away to camp very happy.
At Monash University, a new transdiagnostic approach to anxiety considers the biological, physical, and physiological symptoms within anxiety, targeting the person and their emotional difficulties as a whole in order to deliver tailored treatment. This treatment will reduce therapist training demands and will allow you to have training in one intervention for multiple diagnoses. This new research is an intuitive way to treat anxiety at a faster rate.
People talk about it, the better it is. I think the more people listen and the more they don't label, it's very helpful. I think that the more it gets out there on social media, the more that it's in media, that it's okay, especially in this day and age in high schools where all the high school kids are anxious and all the college kids are anxious.